Now I'm going to scan the fetal skull and head, neck region, face, because that is any anomaly in this region is a major cause of polyhydramnios. The presentation is cephalic, as you can see that the head is near this, just above the symphysis pubis. This is the head of the fetus with now this is the cranium, the skull bone, normal, and this is the fox cerebri, this line. These are the cavum septum pellucidum. This is the thalami, and there is no dilation of the ventricles. All the internal organs of the brain are seen normal. This is the neck of the, this is the neck region. And at this region we do see an anomaly. This is the fetal face. This is the eye, and these are the facial features. Which are normal. No anomaly is seen relating to the fetal face. Now you can see that there is another eye. The second eye is also visualized. See the activity of the patient. How active the fetus is. See the limb movement. Here you can count the fingers. Here. 1, 2, 3, 4, and the thumb. This is the palm of the hand, wrist joint. So this is the hand of the fetus. And these are the fingers. This is the mouth of the fetus, mandible. Short of gel. Head of the fetus. Here we come towards the spine, the neck region, and in the neck region, between the neck and the cephalic portion of the head. Now, this is a solid mass. Seen at the neck region. This one. This is a mass measuring approximately 4.2 into 1.91 centimeters. This is the neck of the fetus, and from here you see this is the cranium, and this is the from where the chest starts. So there is a definite, solid, echogenic, well-demarcated mass at the fetal neck region. Now, this can be, it appears to be a thyroid mass. However, the differentials will be significantly much more. See again here. Now, I wish to show you the brain, the mass, and the chest together here. Here we are. Now you see that this is the cardiac activity of the patient. This is the heart of the patient. You can see the cardiac flicker. And this, even here you can see the cardiac flicker. And it is, the mass is towards, there is a central echogenic tubular structure, which is a vessel, pulsating vessel, passing through this neck region and entering the head, and from here it is entering the, this is the superior vena cava, and from here it's entering the mass. Now this is the mass with a large vessel passing through it. Now in this region it measures, in the neck region, approximately 36 by 32 millimeters or 3.6 by 3.2 centimeters with this vessel, the superior vena cava most probably, and this is the covering of this mass, solid, echogenic, evenly echogenic. It is evenly echogenic, and there is a covering around it, with this being the head of the fetus, this being the chest or thorax. Most important, most common in this region, at the neck region, are the cystic hygromas, but the cystic hygromas are always cystic in nature, with peculiar septations in it, if there is any. And secondly, it can be a teratoma in the neck region, but the teratoma also has a very peculiar shape. It rolls out. It's not evenly echogenic as we are seeing this area to be, and it has a covering around it. Its covering suggests that this area, this is the head, this is the brain. So now this covering, this is the covering, and this is an evenly echogenic mass relating to the fetal neck and neck region, that too anteriorly. Mass is anterior to the neck. This is the head, fetal head. So there is mass. Now I will show you with this curve. And here I will show you with it relating to the chest, trachea. This is the neck region. This is the posterior portion of the neck, posterior neck region. And this is the anterior posterior neck region with two lobes. You can see, you can identify two lobes. Okay, we will study it later. Let me show you this pathology with the chest. Here you see, you can very well see the pulsation in these vessels. Here comes the heart, and this is the mass. So this is the heart, these are the vessels, and this is the lobe of the segment. This appears to be posterior lobe of the mass, and this appears to be the anterior part of the. So bilobe mass can be a thyroid mass. So my finding will be mass relating to the anterior portion of the neck, anterior neck region. Now this is the heart, this area. This is the brain. I am saving the image for further study for myself. Now, I am going to magnify this mass, and then I would like to study and see it's a bilobe shape of a mass with a vessel passing through the center of it. There we are. I am giving a full sweep to the mass to see if it changes its shape or no, it remains the same. There we are. Typical ultrasound scan to perform. But now you see this is the evenly echogenic bilobe mass with a vessel in the center of it, passing through the center. This is the main vessel, and to me, if I am not wrong, it appears to be superior vena cava. And this is the mass. This is the mass, this area, evenly echogenic. This is area, evenly echogenic, relating to the fetal neck region, because from here onwards the brain and head can be seen, and this is the heart. So this is the central area, the neck region, between the head and the neck. In this location, if we measure the lobes separately, the measurements are in longitudinal section, both measure 2.8 centimeter. In anterior posterior diameter, both measure approximately 11.8 millimeter. So the dimensions of the both masses are the same. The dimensions are same, they are well demarcated, they are evenly ecogenic. Even in this case, you can see it's evenly ecogenic, well demarcated. There is no calcification seen within it, within this and this mass. And there is a vessel that is traversing through the center. It can be, if it had been a trachea, then in that case that we should have been seeing air from this and the air shadow. There is no air shadow seen in this region. So this is a vessel emanating, entering the heart. The bilobe, evenly ecogenic mass with no calcification or any cystic area within it. And this is neck mass, neck region of the neck. So this is the main issue in this. The cause of polyhydramnios is this solid, evenly ecogenic, well demarcated mass relating to the anterior neck with vessel traversing the center, having no calcification, with no shadowing, no cystic area within it. There is no cystic area seen within it and is well demarcated. And this is the reason for the fetal activity that we saw patient was showing that. Seeing the fetus to be much active than expected normal. This is the head, again, a review, a short review, the mass, the head.